A warm welcome to all our viewers to our series Natural Medicine. Today, I was allowed to invite a very special doctor. She's not here in person, but we are connected via Zoom. She's a trauma surgeon and sports traumatologist. And she's here today because she has so many things to tell. Welcome, dear Martha Schmidt. Nice to have you here.
Hello.
Trauma surgeon. I don't even want to know what you've had to see in your life.
There are a number of things about which it is commonly said that it would be better not to have seen them. Still, they happen.
Sure. How are you coping with this? How can you process this again and again that you can sleep?
You're in such an adrenaline rush in the situation that you work almost automatically from experience and from what you have learned. And if you don't forget humanity and always remember that the other person could be a family member or friend, then you automatically do the right thing. And when you see in trauma surgery how much is possible nowadays, and how many people can lead a normal life, a return to normal, then that is something beautiful. And you shouldn't think of trauma surgery in such a way that you only deal with seriously injured people. Even the routine work, a bumped little toe, a small cut on the finger, that too is trauma surgery.
Okay, I just had the worst pictures in my head. I once had a lady here who had really bad breast cancer turned outwards. I couldn't get this picture of how the breast looked out of my head for years. Many things can happen there.
In trauma surgery, we mainly have to deal with the patient who had an accident. It's just that this patient who has had an accident has their life too. That means that they can be internistically ill, whether it's just something normal, a bit of high blood pressure or a bit diabetic, and please don't get me wrong, but these are often seriously ill patients who have internal problems, who've had transplants, major oncological operations, or have had oncological illnesses, or are in the middle of it. Elderly patients suffering from dementia and Alzheimer's disease. That's all we have to treat on top of the injury. Because that also plays a huge role in therapy and especially in the support. Because the human being as a whole is hurt. And everything that depends on this, whether it is their own psyche or the psyche of their relatives, that is also something we have to consider and cannot ignore that.
You can see there is a holistic doctor talking with a huge heart, who restricts people not only to the body, not only to the effect, but it's a lady who looks for the cause, as far as I can hear from these few lines.
There is a patient on every cut finger, every bumped toe. I don't just have to treat the knee or the shoulder, or the wrist or the fracture of the femoral neck. It is the first aid. It is the therapy in the sense of an operation, or maybe just a conservative therapy. But this support is also necessary and important for the outcome. Because if I only operate nicely, but the patient is no longer properly or efficiently cared for afterwards, their blood pressure, kidney function, mobilization, and all that is not included, then I will not get the outcome for the patient and the success that we want, and above all, not the outcome that the patient wants, because they want a restoration.
Absolutely, yeah. Why did we actually get in touch? Last week I had a visitor here from the University of Vienna, who was a professor, and he told me that he has done many studies with light therapy, that this is a very well recognised in academic medicine. I also did a bit of research and saw that many hospitals, even in Switzerland, work with light therapy today, especially in wound regeneration and also in pain relief. And that would be my question to a trauma surgeon and long-time doctor. How is it really today? Are you already actively working with light therapies?
Of course, we all know that life is not possible without light. Just think about how in the past rachitis, so the lack of light, the vitamin D deficiency, affected the skeleton of the body. There is light in all of our cells. Light optimizes all processes. Light is the energy that keeps all chemical processes going in the first place. The biophotons are something that thankfully have been of importance, also in academic medicine for a long time, and are also becoming more and more important. Light therapy used to be limited to dermatology and neurology, in the sense of the light showers in neurodermatitis, or in the treatment of depression in neurology. But that's not all. Every cell needs light. There is light in food too. The quality of our food is determined by how many biophotons and how many photons are in it. And therefore, the light is something that not only keeps us alive, but makes life possible. Every healing process in the body must or can be supported by light, and thus works better in terms of efficiency. The healing time, the convalescence time, I can shorten all of this with light.
But now the question, I mean, the audience will now ask themselves, what kind of light are we talking about? I'm in the fresh air every day, or I have light in my apartment. What are we talking about? What kind of light therapy?
I'm mainly talking about therapy with the repulse depth radiator. This is a cold light therapy, which means it comes out of the visible light frequency spectrum of the rainbow from the fraction of red light, a very special, very narrow band of light with 632 nanometers. And we know that it has important functions right in the cell by activating our mitochondria, so our power plants in the cell, to minimize stress here and thereby facilitate and optimize the cell function. Don't ask me exactly how it works. My colleagues from the university were there to answer that. I am only the practitioner who applies it, who sees where it works. It is efficient in healing. It is efficient in pain management. If a bruise disappears in half the time it usually does, if a patient is pain-free after radiation therapy, who's been suffering from an ankle strain for years and kept having problems, then I can simply say highly efficient therapy. It is free of side effects. That is also a very important thing. I can only support the body with light of this frequency. I can't bring anything negative into the body or provoke negative reactions. All I do is feed it with photons to optimize that it does what it should, and that in speed, that is gigantic. This shows what the body is capable of if you support it properly.
If the body has enough energy to make itself healthy, you could say it like that. I had problems with my knee at the weekend, but never in my life before. I could only walk with a limp for 2 days. Then I had the idea that I should take this device and test my knee, and I used it on all sides for maybe an hour. I put some of those red rays in there, and I couldn't believe it. The pain was really gone.
You see, this therapy is not a question of faith. It is an efficient, highly effective, highly potent therapy.
But I always thought to myself, the red light clearly comes deep into the cells. And now, if I got that right, then those mitochondria are being driven through the red light, through this special frequency, to increase their mitochondrial performance, to produce more ATP. And then it's like there are more construction workers on the construction site, and the renovation can begin, isn't it?
Not only that, but they are highly qualified, skilled workers.
That's amazing. And to what extent can I use it preventatively now, when I'm not in pain? I mean, it's good for the body when it is driven regularly, with this energy to promote the rehabilitation of the body.
Of course, you can also use it regulatively. The fact is that every irritative state in the body can basically be treated with it. Even a healthy person always has stress, always has certain states of restlessness, is challenged. As a result, the quality of sleep is not always as you would like it to be. Our systems, which regulate action and periods of rest, get out of balance. Sympathetic nervous system in the sense of the action, parasympathetic nervous system in the sense of regeneration. And when I can support this balance between these two, again by reducing the sympathetic nervous system, and reactivating the parasympathetic nervous system, because regeneration and above all repair can only take place when you are at rest. So a patient suffering from infinite stress, it's not by chance that there is a stress ulcer, so this gastric ulcer that is caused by stress. And if I can work reductively here, and that's very easy by using this red light, to irradiate the solar plexus in the evening, then the quality of sleep is significantly better, and the repair and, above all, the regeneration of the body is more efficient. We have many top athletes who use this device and who also use it preventatively during regeneration.
At the moment, the whole world is a bit trapped in a virus situation. Would it make sense, too, if you simply strengthened your lungs preventatively?
Of course. I myself, after tuberculosis picked up at the hospital, and as a chronic asthmatic, am restricted to some extent with the lungs. And for me, it is normal to do it every day to support my lungs and to use it holistically for the regeneration and support of all energetic cell populations and, of course, the immune system.
Now, one more important point comes to mind in relation to detoxification, also via the kidney. Would that also benefit if you supported the kidneys when you put the red light on the kidney?
Of course.
I have to ask.
The kidneys and liver as our major detoxification organs, so here in particular it is very, very important to optimise their function. All that we encounter during the day, be it the stress that burdens us, be it what we gulp down very quickly because we don't have time, be it all the other garbage that we eat, and unfortunately also drink nowadays, all of this has to be metabolized. It is very, very important to really support the organs, which, as large chemical factories, have to cleanse our bodies, and that's kidney, liver, and also the intestines.
Now, it's a medically approved device. Can the average consumer, like me at home, buy a device at all to treat myself preventatively, or even use it to treat it myself on certain pain points? It shouldn't exceed the point where I really have to go to the doctor.
Of course, a diagnosis is useful and necessary, and also the instructions so that I can discuss with the patient where and how it makes the most sense to irradiate, no question at all. Because it is completely free of side effects, and I can use it basically on an infant from the first day of life to an old patient in the last days of their life. Light therapy belongs to the medicine cabinet for me.
Oh, I've always used the word medicine cabinet before. Thank you, great word, great. So, when I have people at home who have chronic problems that are just normal today, for example, rheumatic complaints, arthritis in the knees, headache, are those the things, because I read in the study about pain relief on an unbelievably high level, would that be the right tool to irradiate a body at these points?
It is definitely the right tool. Of course, also through diet, through the right water, through efficient movement exercises, we can bring the body back to normal. Because as soon as someone suffers pain, the sequence of movements changes. The movement patterns change, and this leads to overloading one region and to protecting another. This leads to muscular changes, muscular imbalances. In other words, a muscle, a region, a joint is more stressed than another. And this also leads to malposition. And I can provide better support in pain relief in order to guarantee optimal processes again here.
I understood it well. The effect has a cause, and if you meddle with the effect, which is also good to have pain relief, or to supply energy selectively, that still doesn't prevent you from having to look at the cause, like your diet.
That's exactly how it is, and about the expression of meddling with the effect. We have the catchphrase of the mature patient. That's where we would ask the patient to see a doctor, as this is often very useful and helpful in order to achieve success more quickly and efficiently.
Unfortunately, I haven't often found that I get advice on good nutrition. But I know what you mean. That should really spread much more. That nutrition and water would also be part of medicine and are also essential points for our health. Besides the light, I've completely forgotten that. It's interesting. Now, something else, in trauma surgery, where we often have wounds, it's also used because wound healing is accelerated. What are your experiences there?
Wound healing can be accelerated up to a third. That means you can almost watch the cells react more actively. The surrounding tissue normalizes. In a wound, if that's a traumatological wound, so a tear, a cut, with that I also have the bruise that grows with the acute injury. And I treat this at the same time, so I have a far more efficient support for all cells that can work easier and better if the surrounding tissue is also treated, and thereby the tissue that is reproduced, so the scar, is also more efficient. Not just coarse, hard, fibrin tissue, but that the body can work and heal really efficiently there. And of course, this also applies to wounds that do not heal well, whether that is after a surgery or an ulcer on the foot, or diabetic changes to the skin. Here too, there is really good support to stimulate healing in the tissue, and also to form the surface again, keratinization of the surface tissue. Also, neurodermatitis, so all these inflammatory skin diseases. I can support all of this well with light and heal efficiently.
I think every dentist would have to give this to their patients to help them heal wounds after dental surgery.
Wound healing after dental surgery is gigantic. And above all, you also have the side effect that the swelling subsides much faster, that the bleeding tendency decreases, because the tissue can regenerate faster, and that there is also less pain afterwards. So you have multiple advantages and no disadvantages.
I'm just amazed. How can it be that something, I now say simple like this, in quotes, something so obvious, has been simply ignored for so many decades, centuries, to actively use it in medicine? Or am I misinformed?
Light has been used in medicine for a long time. Just think about the laser. You have to be very careful with the laser because the light is so focused that I can cause damage here. If I use the light right now, in a different way, like here, where it is emitted via LEDs, I have no side effects. I can't do any cell damage with it. I can only support.
So it's only come now because LED technology is only now possible? Or did they just use sunlight as a therapeutic agent in the past?
If you look at the history of medicine, light has been used in medicine for a long time. More extensive, of course, sick people were brought into the fresh air. You have the light and air health resource, so light is always used. Of course, this high level of efficiency is only possible if you deal with it in studies. And especially in our medicine, nothing may be used on patients that has not proven through a study that it is efficient too. And that takes time, and this device has been around for at least, well, more than 10 years now.
Maybe I'd like to add another minute for an important question. How does one come to find out, like you as a trauma surgeon, that such a technology even exists? How do you hear about it? Do you read all new studies regularly? How does a doctor learn about or get to know this?
I was very lucky to get to know my colleagues from the Technical University in good time, and I was involved in the medical development of this device from day one. And I'm someone who tries to get out into the medical world by using it not only with myself, with my family, with my friends, in the practice, in the hospital, but also tell it to everyone who wants to hear it and who doesn't want to hear it.
Dear Martha Schmidt, thank you very much for this interview and these enlightening words to something sensational, revolutionary, that's how I'd call it, that has this great effect confirmed by academic medicine that's used in hospitals, but we could actually use it at home for ourselves too. Thank you very much, dear Martha Schmidt.
You're welcome. My pleasure.
To you, dear viewers, I thank you very much for watching. I hope your heart opened a little too when you see such a trauma surgeon and listen to her. Hopefully, we will all never have to visit her in practice. I'm sure about that. She smiles in the background, but it's true, I'm sorry. It is better to have a glass of wine with a trauma surgeon in the evening than to hear or see her in action. But nice to know what kind of people are behind it, who do so much good. Thank you again, dear Martha Schmidt, for everything you have done in your life. I think you have to be an incredibly strong and big soul to do a job like this. Thank you very much. All the best to you too, dear viewers. See you next time.